Hello, everybody. This is Dr. Newmark, and this is our week 13 highlights video. I am going to jump right in. We only had one scholarly article in this week, and then we had several websites that I wanted you to review. Okay, so the scientific article that you read was from the International Journal of Environmental Occupational Health. So it's an adjacent medical field, occupational health and safety. And I thought it was sort of an interesting component of this larger series of questions about the impacts of uranium mining. And I chose this to focus on in our unit because it is a sort of an economic phenomenon, a cultural phenomenon, and a medical phenomenon that has had lasting impacts in our state. So I ask as the first question related to the inquiry into this healthcare related article, what journal the article was from, I just told you, and what can you tell? Can you tell a bit about its purview and the kinds of factors and the medicine related aspects in play in this research study, just on the basis of that journal's focus? Of course, we have to know what the expectations are for a journal of this nature and who its typical readers are in order to really make sense of the approach that it's using in its inquiry. So the study is interested, as the author says, Jones, in aggregate health costs. So if uranium mining is once again a growth industry, which is mentioned in the article, knowing the cost impacts is important. And it's a growth industry potentially internationally. Does this configuration of impact strike you as an important angle? And have you thought to explore other medical studies that research other kinds of uranium exposure impacts? So this study examined lung cancer deaths among miners in grants, but there are other kinds of cultural, medical, familial impacts of the legacy of uranium mining and radiation exposure in our state. So I ask, why was Grants, New Mexico, the focal site of this economic cost analysis? He gives some interesting reasons for why Grants. So this is a photo actually that I found from a website that is from a legal group that supports people who have been impacted by the after effects of uranium mining in seeking to seek redress for the healthcare impacts that have befallen them since. So that is a historical image of a uranium mining operation. So I found the methodology in this article to be really compelling and interesting, given the ethical and social justice oriented nature of our GCERT program's design. So I figure this concept is one we should explore. So he writes, annualized deaths were converted into monetary costs using widely accepted value of statistical life year, VSLY, and medical cost estimates. Jones continues, working level month rate on exposure standard is an interesting concept. So costs were categorized in two ways: lifetime medical costs of lung cancer diagnosis and treatment, direct costs, and the cost to society of premature minor mortality, indirect costs. So you can see this is a very economic study. I mean, you read it. I think this author really takes some of these ethical concerns head on in this next comment. So of interest is society's willingness to pay for a risk reduction benefit, which is the case of minor mortality, which in the case of minor mortality is the value of the reduced probability of death experienced by the minor population. This is not the value of a human life or the value of life saved, as is sometimes mistakenly reported. Instead, it is the amount that some population of interest would be willing to pay for saving one life in expectation, which economists call the value of a statistical life, or VSL. So this is actually a really interesting study that enfolds within it all kinds of questions that are often subsumed in medical research, but here they're put very much on the face. Many kinds of medical research require lots of financial investment, grant funding in order for them to be propelled, with the goal being the saving of lives. And we know that when we are considering Alzheimer's research or cancer research or um, you know, research into epilepsy or asthma or whatever it may be, certain kinds of research endeavors generate a lot of public support through donations, and the scientists are able to secure grant funding. But there is a certain competition between funding agencies, well, between scientists attempting to get granted funding. So it is all part of this economy that strives to propel research in order to save human lives, right? That's the bottom line of this kind of work. And in a way, the written word is the vehicle by which the money flows, right? In order to secure grant funding from the NSF or the NIH, you have to submit a research proposal. Again, for this case to be made in this article, for the readers to become more aware of these issues concerning the amount that some population of interest would be willing to pay for saving one life in expectation, this value of statistical life, that is a configuration, an idea that is presented in this kind of persuasive communication in this modality of a scientific journal article. So these things are all intertwined. So the author writes, minors succumbing to lung cancer and working before 1971 died on average 21.7 years prematurely, compared to an average of 20.6 years for minors working after 1971. I mean, I think it's pretty stark to see these figures, this data presented in such a unembellished fashion. So this research contributes to the growing international literature, the author writes, of uranium legacy impacts. This is the very end of this article. Uranium mining brings jobs, tax revenue, and critical infrastructure to rural areas, but has non-trivial impacts on the environment and human health. While the qualitative impacts of mining have been presented in media outlets such as the New York Times, USA Today, and through several books such as Yellow Dirt, The Navajo People and Uranium Mining, which I'm showing on the screen there, Yellow Cake Towns, its quantitative costs are largely unknown. This is the first study of its kind to quantify the human health costs from the mining perspective. This is relevant today, given renewed interest in uranium mining across the world. It does seem really crude to correlate or reduce to a monetary figure the health costs of these kinds of endeavors. And of course, we have to think about the larger picture. What is uranium mining all about? What is the larger apparatus that the uranium supports? I'm going to sort of bracket that, and then we're going to move to the websites that I included for this week. So I'm showing the landing page of some of the websites that you explored. So the radiation exposure screening and education program, the National Radiation Exposure Screening and Education Program, as I said. So we've got one coming from UNM Health, one coming from the Health Resources and Services Administration. And then this last document was the Public Health Statement for Uranium. That one was the most sort of simplistic in its design, the longest as a PDF. It ran many pages and kind of breaks down many facets of what uranium is, what its impacts are. So I'm going to switch ahead here to the next, and I'm hearing some things under my door. I'm sorry for the disruption in the video. I think there's perhaps somebody at my door, a child, but we're just going to ignore that for the moment. Sorry for the disruption. So the next series of images I have here on the screen concern this War-Related Illness and Injury Study Center. That's a veterans initiative. Next, we have the Congressional Research Service, the Radiation Exposure Compensation Act, RECA, as I've mentioned many times in this unit. Then the bottom two images are this uranium mining map. And this is an interactive resource. And so this page here on the left is from an information guide about how to use this resource. And I'm wondering if you clicked around at all on it. Now, I'm showing these items all together in this unit because I think it shows sort of the volume of text and persuasive imagery that has been emerging over the years as a vehicle for people who have been exposed to uranium through mining and, other kinds of impacts downwind from, atomic testing, how these textual supports have proliferated in order to serve the people who have suffered. Again, we can take a little bit of a cynical view about how it has been necessitated as a result of human lives lost. RECA is not a phenomenon that has been in existence since uranium mining began. It's only emerged as a mechanism to help provide resources for people who themselves are sick or have lost family members as a result of the cancers and other health costs that have emerged. So I want to close this video by asking two questions. These are the questions from this week's discussion board. So the first one is, how might rhetoricians and technical communication scholars engage interdisciplinarily with medical and healthcare writing like these examples? And why should they? What might they bring, technical communicators, to these communication scenarios? So as we know, tech writers work with subject matter experts. Those are the people who are the scientists or the engineers or the disciplinary specialists. So the tech writer is often a generalist. So if we train tech writers with sort of an ethos of social responsibility, what is it that they might bring to these kinds of compositional scenarios where information is intended to be presented to the public in order to address these long existing problems? So I would be interested in hearing how you grapple with that question. Now, the last question is much more complicated, so I'm going to talk about it a little bit. So if we invoke the idea Dorpeño presented of science and scientific texts having quote unquote material existence following Althusser, the material existence of an ideological practice, how do we reconsider what we might mean by materiality? So how can the responsive or responding texts, which is what we saw on those websites and in journal articles, those respond to an actual social and healthcare circumstance. So how can the responsive responding texts, so the web resources provided for those impacted by uranium mining and downwind after effects, for example, manifest their material existence in ways that matter, especially for those who were often catastrophically impacted by other material physical circumstances, physical labors or toxic alterations of sites of familial dwelling. So some communities downwind from the Trinity site, for example, have become so contaminated that people after many generations are still being inflicted by cancer as a result of the poisoning of their community. I'm asking here a question that has to do with this larger Althusserian concept of material existence of an ideological practice. So how do perhaps capitalist ideologies or late 20th, early 21st century concepts of militarization and weaponry, which emerge as material presence, how do these perpetuate certain ideologies, and how do some of the textual outputs that you viewed themselves further a kind of ideology that values uranium mining and all of the additional social components upon which it touches? So I know that's a little perhaps esoteric, but I'm not suggesting you run out and read Althusser, but you could, and maybe you have in other classes. But I think this question of how perhaps these texts as themselves material work to support certain ideologies, even as they expose some of the health costs that furthering some of these sociopolitical goals have generated in the past. It's a pretty complicated thing to discuss. So I'm excited to see if anybody engages with this question in the discussion board. And thank you very much for watching. And I hope that you all have a nice rest of your day.